Hey everyone, Dr. Eric here from MedBetter Health, where we talk all things dementia. Let me ask you a question. Are you a caregiver and you have a loved one, a person living with dementia, and all of a sudden you're noticing that they're having this acute change in their mental status? They're acting a little strange. And some people are telling you, well, don't worry about it. Listen, it's probably nothing. It's just the dementia progressing. You know, Dad, don't worry. Well, this video is for you. So, what are we talking about? Let's unpack it. We're talking about sudden confusion in dementia. Check for a UTI. We're going to go deep into this topic. Why overnight changes in behavior are medical red flags and not just dementia progressing. So, the myth. The dementia suddenly got worse. Let's take a look at this. So you have, here's Dad's baseline, and all of a sudden, boop, it suddenly gets worse. That almost never happens. Well, Dr. Eric, why did you say almost never happens? Well, there's one type of dementia called vascular dementia. What's vascular dementia? That's when someone has a stroke. That's when someone has a history of high blood pressure, diabetes, they're not taking the right medications, and all of a sudden, they're over here, and then boom, suddenly they have a stroke, and yes, that's when you can have sudden changes, and it's dementia related due to the stroke. For most dementia, this is not the reality. Most dementia, this is a myth. It never goes boom, suddenly goes down. What's most dementias? The reality is that dementia changes slowly. It's a slow progression. Well, Dr. Eric, what then can change suddenly? What can change the sudden cognitive function of mom or dad? It's something called delirium. And we're going to talk about delirium because delirium is what? Well, let's take a look. Delirium is an acute. What does it mean acute? Does it mean it's cute? No, it's not cute. It's acute. It's an acute, it happens, boom, right away, right? State of confusion, which is often triggered by medical stress. What does medical stress mean? Well, I could be in a hospital because I have pain in my leg and I need surgery. And now every 8 hours, including 2 o'clock in the morning, I'm being woken up to take my blood. I'm in an unfamiliar surrounding, and I'm woken up and my circadian rhythm. If I have a little bit of dementia, I'm going to go into delirium. I'm going to go into state of confusion. That's number one. So watch out in the hospital for delirium, for confusion. Number two, urinary tract infections. They are notorious for causing delirium, which is an acute confusion and change in mental status. Abnormal labs, right? We'll talk about medications, but abnormal labs. So sodium level goes down because I'm taking a diuretic that the doctor prescribed. And now all of a sudden, boom, my sodium level is low or high, and I go into delirium. I go into confusion. That's not my dementia getting worse. Those are specific reasons of why something happened, right? Okay, now let's continue going. This is such an important chart for you to know and to be educated on, right? The value you're getting here is so incredible. And by the way, this type of value, if you like what you're hearing right now and what you're seeing, I want you to subscribe to our channel. Definitely subscribe. I want you to comment below as well, because we actually have an incredible program called the Guide Model. It's a Medicare program where my team does one-on-one education with you, the caregiver, to help you be educated on things like that. We also provide a whole host of things like, for example, having someone in your home help you out for free when you're exhausted and paying for home care. But we'll talk about that more later. Let's go into this specific chart over here in this graph. So dementia. Dementia is usual gradually, right? The onset is usually gradual. I mentioned to you that there is one dementia that changes happen right away, right? Which one is it? Who remembers? Who remembers? That's vascular. I want you to comment below. Vascular, right? Write it down so you don't forget it. Now, it's slowly progressive. They're generally alert. Their attention in the early stages is alert. The cause, what causes it for the majority, the most common dementia is which dementia? Alzheimer's disease. That's the most common. And it's a chronic progressive brain disease. And as of today, right, at 2026, it is irreversible. But we're working on that. And I just came back from Washington, and there's some incredible things that we're working on. And you can take a look at the video that I recorded right over here or over here, depending on the platform that you're using. So what is delirium? Well, delirium is sudden, hours to days onset. Okay, course, it's highly fluctuating, and it's actually often worse at night. Huh, interesting. So it's not just sundowning. And if you're interested in a video about sundowning that we did, there's one video right over here that you should click on if you're on YouTube channel. It's incredible. Okay, so it's not just sundowning, but at nighttime, it's worse. What happens to their attention? Well, inattentive, easily distracted, and they're unable to focus. What's the cause? As we talked about, usually an acute medical trigger like a UTI, okay, or a pneumonia, or pain, or medication. Don't automatically go and say, I'm going to treat him with an antipsychotic like Seroquel. No, I want to figure out, is it delirium and what's causing it? Imagine if you're just giving someone Seroquel, right? And this is not for medical advice. You should always talk to your doctor if you need to make a decision. But imagine your loved one has a urinary tract infection, and they're acting kind of strange, right? They're confused, they're agitated, and you don't know what's going on, but you're like, it's probably the dementia. Let me give them some Seroquel. And you give them the Seroquel, the antipsychotic, and it calms them down because it knocks you out. But did you treat the UTI that's actually there? No. So what happens? The UTI, like a little fire, gets bigger and bigger and bigger and bigger until the fire gets so huge and it takes over the whole body, and you have someone in the intensive care unit because they have something called sepsis, which is bacteria in all over their body because that bacteria spread from the UTI. Because we were calming them down with the Seroquel, but we didn't look at the real problem, which was the UTI. So delirium, very often, if it's due to a UTI or a pneumonia or medication, it's actually reversible when you treat the root cause. Okay, moving on. The 24-hour fluctuation chart. This is the behavioral level over here, right? And this is the time on the x-axis. So they could be relatively calm, right? And then all of a sudden, with delirium, they could have a sudden extreme agitation. Then towards the night, they can actually become lethargic, completely unawakeable, and refusing dinner. And then at nighttime, they can be very confused, and usually they fall down, right? When they have delirium due to UTI, a lot of falls happen, right? Because they're not in their normal cognitive state, and they're waking up, they're getting up, they're confused, they see things, their balance is off. We gave them some Seroquel, unfortunately, because we didn't look at the cause of what's causing it, which was a UTI. They fall, they break their hip. And you know what happens when they break their hip? They're in the hospital, surgery, and a whole bunch of things go on. So this is very, very important. Key takeaway. Caregivers might think that the person is faking it or just having a bad moment because they seemed fine hours earlier. They were okay here, so that means this is just a moment in time. No, it could actually be delirium, because delirium can go up and down. It's not necessarily once you have the UTI, you're completely confused. You can have good moments too during delirium. So always pay attention to that. This rapid fluctuation is a clinical hallmark of delirium. Okay. Now we're gonna move on and speak to something that's super, super important. And I want you to know this. This is so important. Behavior in a person who has dementia, behavior is communication. I want you to repeat after me. Behavior is communication. What do you mean by that, Dr. Eric? I don't behave, I speak. Yeah, but you don't have dementia if you're a caregiver and you're listening. So the body, what happens is, in a dementia patient, whether it's pain or infection, they're unable to communicate the information. So instead, what they do is they exhibit behavioral changes. So the fact that they are exhibiting a behavioral change means they're communicating to you. Yes, you listening right now, the caregiver, they're communicating to you and saying, something is off. Something is bothering me, right? And you look into that because that's super important. So, key insight, a person living with dementia may not be able to say, it burns when I urinate. Instead, their body communicates this systemic stress through behavior. Don't ask, why are they being difficult? Ask, what changed in their body, right? What changed in their body that is causing them to act differently? So, oh my God, why are they acting so difficult? That's the one question that we shouldn't ask. What changed in their body is the question that we need to ask. So, the atypical presentation, why infections hide, right? In classic UTI in younger adults, how does it present? Well, younger adults may have burning when urination. Okay, that's, yeah, and you could feel that. You could say that, huh, it burns, right? Because I can communicate that. Younger adults have increased frequency of urge to go. I got the urge to go. I want to go, the urge to go to the bathroom. Younger adults have fever and chills. And younger adults also have pelvic or lower back pain. All right, now let's contrast that to atypical UTI in older adults with dementia. This is an important slide for you to know. Well, sudden confusion, severe confusion, or delirium is one of the first things that you'll notice with time, right? That's a hallmark. New agitation, restlessness, or paranoia, extreme lethargy, sudden inability to walk or stand, sudden falls or feeling dizzy, loss of appetite or withdrawal. What are you seeing? You're seeing that the most typical things we see in younger adults, we may not see that in older adults with dementia. So you may be thinking, well, I know what a UTI is. Mom doesn't have a fever. Mom doesn't have burning on urination. That may not be seen in mom in an older adult, right? Especially if mom has dementia. So the takeaway box for you guys is, in frail older adults, the immune system, because it's weaker, may not mount a classic fever. And so it may not mount this classic results, right, that we see. And what would happen is, it masks the localized pain as well. The dementia masks the localized pain. Why? They're unable to communicate. They're unable to tell you that they're in pain. So you don't even know, right? And many of them have diapers on. Let's say if it's a severe dementia, you don't even know the frequency, right? Oh, I'm changing 5 diapers, maybe 9 diapers today. Nobody really keeps track of that to that degree. You can get lost, right? Confusion, therefore, is often the first and only symptom that you will notice. Sudden confusion. Now, the cascade of confusion. If you take a look, vulnerable brain, systemic stressors cause inflammation and chemical imbalance, which leads to delirium response. Okay, the caregiver's response. This is one of the most important slides you can look at. Now again, this is not medical advice, but it's an educational advice that I want you to understand. So what do? You're the caregiver. Mom is now different. I'm going to just say different. What do? How do you evaluate it? Well, step 1, observe. Is there a sudden change from the baseline over hours and days? If the answer is no, there's no sudden change, continue monitoring. There's no change. Everything is the same. If the answer is yes, there is a sudden change, then you have to triage in your brain. Well, what does that mean, doctor? I'm not a nurse. How do I triage? Well, this is how you triage. First, I got to figure out, are there urgent red flags? Like what? All of a sudden, mom is not able to pick up her right hand. All of a sudden, mom is slurring. You don't understand what she's trying to say. Right? All of a sudden, she's completely confused. Completely confused. Your inability to wake her up. right? You're mom, 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 and she's not waking up. Or there is severe chest pain. Oh, I got chest pain, right? Or she fell and there was a major impact on the head. She hit her head and you're not sure, man, she hit her head and now she's acting a little strange. If those are yes, you call 911 and you seek emergency care immediately, right? Now, if those answers are no, right, there's no sudden changes like that, but there's some confusion, but not to the degree I just described, then the action is you document the exact timeline, what happened, and then you call a medical professional, right? You call mom's doctor. And when you call mom's doctor, you don't just say, I don't know what's going on. Remember, garbage in, garbage out. What you tell the doctor, that's what the doctor is going to really know and give you advice, right? Good information in, good results out. So you call them and you say, look, doc, there is a sudden change from baseline in my mom who has dementia. I'm not sure where this is from. You know, is this delirium? Is this infection? Is it dehydration? I don't know what to do. And then go into the details. So as you're going into the details, right, what do you have to make sure that you tell them? Number one, it has to be a caregiver who's talking to the medical professional who actually knows the medical history of the patient, right? That's important. Number two, you bring the glasses, the hearing aids, and the dentures. The hearing aids, if they're able to answer and they can't hear, they won't answer. So there will be no real information. The glasses, if they're asked to read something or to see something, say, how many fingers do you see? And they don't have their glasses on, that test will not be accurate because they just can't see, right? Number three, very important. Don't just assume that the hospital has the meds in the records. The meds they have may be from 6 months ago and there may have been 6 changes there. So don't just assume that, right? And use concrete examples when you're describing to the medical professional. She usually eats breakfast alone. Today, she can't even hold a spoon. Rather than general labels, she's confused. Give concrete examples of what changes you're seeing in mom, right? And this is the logbook that I want you to keep in your mental mind. You're keeping it mentally and you're also writing it down. What changed? Is there confusion, agitation, sleepiness, hallucinations, appetite, bathroom habits, walking, falls? What changed? Number two, when did it start? Right? Exact date, time. Number three, what happened recently? That's so important. You're playing Sherlock Holmes. You're making an investigation. What happened? Was there a missed medication? Right? Usually mom's on something to keep her calm, but here there's a new caregiver that came in. Medication wasn't delivered from the pharmacy. Was it that? Was there a recent hospital visit with new medications that were started? Was there a fall that she hit her head and now she's acting in confusion? Is there severe constipation? When was the last time mom actually went to the bathroom? That's so important to know, right? I mean, that's because if constipation is defined as no bowel movement in 3 or more days, right? So is that the issue? Or is there dehydration? So now you're looking at Sherlock, and before you speak to the medical professional, you kind of got those facts in your head. Now, what's the baseline? What could they do last week, and what can they not do today? Right? So I hope that you found this video very helpful. In fact, I'll be so bold to say that after watching this video, you have now the ability to prevent someone from dying unnecessarily. Right? I'll be so bold as to say that. And I'll be so bold to say is that that's what we do here at Better Health. There's a new program that came out, and we were selected. We're a few selected nationally, right, to participate in a Medicare program. The program's name is the Guide Model, and Better Health has an incredible Guide Model program out there. What does the Guide Model do? Well, if you're a caregiver and you would love for someone to educate you just like this, one-on-one, and to be your personal concierge care navigator, Medicare now pays for that. And if you're a caregiver and you're exhausted and you just wish that on a Sunday for 4 hours, for example, someone else could sit with mom, could do a little bit of cleaning, could do a little bit of cooking, and you and your husband can go out and have dinner or go play golf or do something incredible together, right? Go to the beach. This program through Medicare now pays for a private duty home care. It was never done before, but now it's paid for you to have that opportunity of relief. Now, I'm not going to go through the whole program, but if you're interested in learning more about the program, you could look at our website over here. You can scan the QR code. You can look for the link in our description, and you should comment below. If you're interested, just comment below. I'm interested in learning more about the program. Please reach out to me, right? And we would love to talk to you and literally make a difference in your life. I'll talk to you in the next video.